I'm Mort Cooper, your host on Change Your Voice, Change Your Life. In the studio with me is a young lady, Nadia, and we're talking about voices. She has a problem, a vocal fold growth, and it's called voice suicide by the way she's talking. And it happens when you misuse your voice and you get the wrong image of how to use your voice. Nadia, you're surprised as to how I got into the field. You had a young lady tell you to bring your voice down, and that was 6 months ago.
Yep.
You were higher pitched, right?
I was higher pitched.
And now talk in the old voice, the one that you came in with to my office yesterday.
And then I brought it down lower. But basically, I didn't bring it, I think I was teaching in this pitch, this low, and now, but I was able to bring it back up to my regular voice, but after teaching like that for so long, now I have no, well, I do have a choice now that I met you.
You understand you have choice.
I understand
but
now.
You're in the lower throat,
your
neck muscles and so forth. And that happened only 6 months ago.
Yeah, my voice automatically wants to go here if I don't think about it. This is where it goes.
That's raspy and hoarse. And
yes.
You've seen ear, nose, and throat doctors. They want to do surgery, and I'm saying your problem is very simple, natural approach to it. Change the pitch, bring it up, and change your focus up in the face. I'm going to tell you about my experiences like Nadia. Only when I was younger and I was going to college, I talk like this. This is Morty Cooper. Hi, little Morty Cooper. I talk like that. And two well-intentioned college professors told me to bring my pitch down. And they were very kind, and so I began to talk like this. And everybody loved it. The women loved it and so forth. There's only one problem, Nadia. My voice was killing me, and it hurt to talk. My neck muscles were aching. Eventually, that voice unraveled, and I went to see 12 MDs. One told me I was dying of cancer, gastroenterologist, a well-intentioned fellow. He didn't know what it was, but I was hoarse, and the hoarseness was ongoing. And I had seen 4 speech therapists, and they couldn't help me. They liked this voice was fine. But it didn't work. Now you hear the voice up here. What you did is you had somebody, a young lady, tell you to bring the pitch range down because you were too loud. I had somebody, 2 well-intentioned college professors, tell me to bring the pitch range down because I was talking nasal like New Yorkers talk. Hey, how are you? What's going on? And so I got into the lower throat just the way you got into the lower throat. Image, somebody set us up. And we don't know what's right, and we listen to people who don't know better. They're well-intentioned, and then what happens is our voice unravels. So the program is titled Change Your Voice, Change Your Life, because when you lose your voice, it's very hard to communicate, or when it's impaired, it's very difficult to talk with people, and you feel that it's effortful, and it hurts to talk, and your personality changes, your career changes, and so forth. And we are told it's genes, it's a dystonia, we're told it's a disease, we're told it's acid reflux, we're told all these things, but those are not the relevant causes of our bad voice. It's we're talking in the lower throat. Nearly all bad, raspy, and strangled voices are in the lower throat. All strangled voices are in the lower throat. So if you put your voice up in the face, you have a chance to sound great, feel great, and have a voice that is healthy. Now we're going to talk about breathing. Put one hand on your midsection, okay? And one hand on your chest. I want you reversed hands. So you put that hand over there and put the other hand a little higher, okay? Now, how did you breathe when you came in yesterday to see me? No, that's typical. That's the whole gambit. Women talk with upper chest breathing.
Right.
And the other attribute is they hold their stomach, so it doesn't show.
Right.
Did your mother ever told you, hold your stomach in?
Well, I do, because when I train, I train to, engage your core, so it stays in my brain and I engage it the whole day. So I'm holding it in the whole time.
You're holding your stomach in. And you should not hold your stomach in.
Right.
The stomach, when you breathe in, should go out. Just breathe in through your nostrils, through your nostrils. Just breathe in and see if your stomach goes out, or is it your chest that's going up?
Right now my chest is going up.
Right. When you lie down, supine, what happened in the office yesterday? Your
My
stomach
stomach went up.
went out.
I mean, my stomach went out.
When you breathe in, lying down, that's natural.
Yes.
So when you're doing what is natural, when you sleep, your stomach is going out, and that's why you can sleep easy,
Yes.
because you're relaxed.
Exactly.
And when you're breathing normally during the daytime, normally in quotation marks,
That's supposedly right.
it's not normal,
Right.
it's tension-ridden.
Yeah.
Was it simple to show you how to breathe
Oh
properly?
yeah.
5 seconds, 10
Yeah.
seconds? Can you do it?
Yeah.
Can you do it when you talk?
I can if I, well, for now I have to think about it since it's been reversed. I have to, but I can do it.
Yeah. Now, can you keep your pitch range up? Can you rub your head?
All right. Yeah.
You can't put two steps together.
Right now, no.
Okay. What I want you to do is hum the first bar of Happy Birthday. First, I want you to take a breath. Breathe through your mouth, not with the upper chest. Let your stomach go out. Do you see my stomach? Like a dog panting. Can you do that? Okay. Does your stomach go out?
Yes.
Okay. Your stomach should go out, and then you talk on the air that you've gotten, so the air is going over your vocal cords, which produces a very weak sound at this level in your lower throat. The larynx is in the lower throat. And the sound is then amplified in the face, called the mask. So if you breathe in and just go, the stomach goes in and the voice goes into your face. And that's where you get amplification of your voice. Right. Now if you take your finger and put it at the C spot, that's the spot at the top of the solar plexus, the soft tissue, below the breastbone, and you jiggle it very quickly but gently, and do you can feel you feel the resonance in the face, and that's where you want to talk. All good and great voices are in the face. All good and great voices are in the face. Try the C spot. You feel the resonance there? Now when you talk, what happens?
When I talk, I go down here.
Right.
But I have to keep it up here.
Do it with the C spot. Okay. Now I'm going to give you the microphone over here that shows the pitch. You're looking at a pitch meter. It's a piano keyboard, and it shows the pitch of your voice instantaneously. So I want you to talk, just talk normally the way you talk.
The way I'm talking right now.
Right. I want you to then take your finger and go, What's the difference? Can you feel a voice up there?
Number one, I can feel the voice up here. Number two, it's higher up on the...
Yes. Does it take the tension away from the lower throat?
Yes.
Do you have tension in the lower throat? How long have you had tension in the lower throat?
For the last 6 months, roughly. It's been getting worse lately.
How much worse is it getting?
A lot, because now it feels really tight all the time.
And this began 6 months ago.
6 months ago, yes.
Our culture is to bring the voice down. Women want to sound more in control, and they're told to bring the pitch down. You could bring the pitch down, but you have to bring it down into the face. So, and you were told, because you're loud, to bring the pitch down, so you went from loud and you went all the way down here. Instead of modifying the volume up here, instead of talking this way and talking this way and talking this way, you can talk softly in the face. You must always talk in the face. That's the saving grace.
In the face.
In the face. That is the saving grace. There are conditions called nodules, polyps, and contact ulcers. They're created by putting too much tension in the lower throat with the wrong pitch and the wrong focus and the wrong support. Many people breathe incorrectly, and they suffer from that wrong breathing because they're tired, they're fatigued, they're exhausted. If you breathe like this, you're breathing like that. It's exhausting. So you have to learn to breathe from the midsection, diaphragmatic breathing, and it relaxes the body, and you talk up in the face, which gives you health, and it gives you salability, gives you knowledgeability, it gives you believability. When you're talking like this, people can hear you. When you talk in the lower throat, do people have trouble understanding you? Do they ask you to repeat yourself?
A lot of times, yeah, they'll say, huh?
Yeah. I want you to hum the first bar of Happy Birthday. Right. Okay. Now, it's very easy to change the wrong voice to the right voice. I've done it on Oprah. I've been on Sally, Maury. I've been on CNN a number of times. I've been on Regis Philbin, Larry King. The list goes on, Charlie Rose, and so forth. It's easy to change the wrong voice to the right voice in seconds. My field, for one reason or another, in 1980, they profiled me in the Wall Street Journal front page as a miracle voice doctor because I work with Norton Simon. But the issue is that my field believes it takes a long period of time to get the right voice, months. I take 5 to 10 seconds to change from the wrong to the right voice, and then what you have to do is do it throughout the day. Is it easy to change from the wrong voice to the right voice?
Yes. Well, easy when I'm doing the exercises
The
or
C
the
spot?
humming.
Do the C spot. It's easy to do, but you can't do that in public. They'll put you away.
Right.
You can't hum Happy Birthday. Can you hum Happy Birthday? That's where your voice goes, right to your face. You can't do that in public. What you can do is, say it spontaneously and sincerely. And then, one.
One.
Two.
Two.
How are you?
How are you?
Right, but, how are you?
How are you?
Do you feel the, All right, now the second stage is when you're doing it privately, not in public. Try that. Do you feel that in your face? You're feeling resonance in your face. That's where you should be talking. That's the saving grace.
Right.
The lady who told you to lower the pitch of your voice missed a step. And the step is, you can lower the pitch of your voice, but you have to stay in the face. You had volume, so you were talking this way, and then you talked all the way down there. When you talk in the lower throat, it cuts the volume.
Yes.
It also creates, what are the symptoms that you have?
Raspy, hoarse, tension, strain. I get tired of talking, lose loss of breath.
I believe everybody can hear that. Do you feel it?
Yes.
By going to the face, you take the pressure off the lower throat muscles. By breathing from the midsection, you're taking the pressure off the lower throat. But if you had midsection breathing called diaphragmatic breathing, and you talked in the lower throat, you would ruin your voice faster than before. Because you're pressuring the lower throat muscles, and you can get lots of problems called papillomatosis. It's a premalignancy, leukoplakia keratosis, and you can get this condition called spasmodic dysphonia. I want you to blow out all the air, blow out all the air, and I want you to count to 50 aloud. Just do as I'm asking.
1, 2, 3.
Don't take another breath.
4, 5,
Loud.
6, 7, 8, 9, 10.
Keep going.
11, 12, 13, 14, 15, 16.
You're getting a condition called a strangled voice.
Whew.
The medical community, my colleagues, I was on the staff and faculty at UCLA Medical Center years ago under Jack Pressman, who said I was the best speech pathologist he ever knew, which was kind of him. And Jack Pressman was the best ear, nose, and throat doctor I could ask for. He wanted me to bring him success, and for years I brought him success. I published in peer review with Jack Pressman's blessing, and I showed how you can cure unilateral cord paralysis by all natural direct voice rehabilitation. I do it differently than my colleagues, and I've been in peer review in medical journals. Contact also, I've been in peer review cures. 16 cures out of 16 cases, and we had 14 cures of unilateral cord paralysis and 90% recoveries of unilateral cord paralysis published in peer review. I've been published in the International Association of Logopedics in 1980 with cures of the strangled voices considered hopeless. The medical field says, forget about it. It's all related to talking in the lower throat. The nodule that you have is related to you talking in the lower throat. Benign growth, such as what you have, is caused by wrong voice misuse. All these other conditions, I find, are related to wrong voice misuse. My medical colleagues believe it's due to a disease, it's due to a dysphonia, it's due to a dystonia, a neurological problem. Acid reflux is big today, and they say try that. Hydration, drink a lot of water. Water cannot touch the vocal cords. It cannot touch. If you drink water and touches the vocal cords, you'll be on the ground in spasms. So it cannot help the vocal cords. It's believed that it lubricates the vocal cords. I don't accept it. What I do is lean on those who have been before me, who have been the greats in my field, and they have pointed out that you have to change the pitch to go up into the face, and you have to have midsection breath support, and it's all natural. The medical community is not trained in voice, so when you go to them, and what's your story? You went to ear, nose, and throat doctors?
And I needed to pretty much take it easy from work, not teach. And was going to need, and if I continued to, then I would eventually need to have surgery to remove the nodules. Sometimes they do go away on their own if you rest and not speak for a while.
Where are you talking now?
Right now?
Yeah.
I'm trying to keep it up
But you're in
higher.
lower throat. I want you to hum the first bar of Happy Birthday. Again? And I want you to say to me, Happy Birthday, Mort Cooper.
Happy birthday, Morton Cooper.
Where does it go?
Low.
Low. I want you to say, Happy Birthday, Mort Cooper.
Happy birthday, Morton Cooper.
No, it's dropping down. You had a higher pitched voice 6 months ago.
Yes.
Somebody told you to lower the volume, and like somebody told me, don't talk like that, and talk all the way down here. They forgot to tell me to talk in the face. Talking in the face is a saving grace for nodules, polyps, contact ulcers, pre-malignancies, papillomatosis, leukoplakia, and keratosis. Now, the medical field is right on the mark. Cigarette smoking or smoking of any kind can encrust the vocal cords and create problems, serious problems. But I work with people who were not smokers and had these conditions. And by changing the vocal placement from the lower throat, they were in the lower throat. The medical community is not trained to listen to voices, they're trained to see vocal cords. So you go to an ear, nose, and throat doctor, and the young lady tells you you have nodules. What else does she tell you?
I need surgery to get them to remove them.
Did she tell you to change your voice?
No. She just told me not to teach for a while.
But she's telling you to get out of your profession.
Exactly.
And you need to earn a living.
Exactly.
Okay. I'm saying change your voice, you change your life. And you can do it naturally. The medical people are well-intentioned, they're compassionate, they're humanitarian, but they are not trained in voice. You want to take the voice from the lower throat to the face. Did she point out that you're talking in the lower throat?
No.
She's talking about your symptom.
Yes.
She's talking about the nodule, and she's talking about your raspiness. But she's not telling you what it's coming from.
Right, which if they did surgery and I continued with the same pattern anyway, would just, I mean, it would remove it, but I would be...
Right back where you started from. They're removing a symptom. Medical treatment for voices are basically symptom-oriented, surgically or Botox voicing for those with spasmodic dysphonia, or even for papillomatosis and other voice problems. My position is a little different than my medical colleagues, and that is change your voice, put it up in the face, because talking in the face is a saving grace. And it gives you a great sound, and by putting the air support in the midsection, if you look at me and watch what I'm doing, 1, 2, 3, 4, 5, you can see my hand going in. 1, 2, 3, 4, 5. That's diaphragmatic breathing. Now when you talked before, and we're going to do it again, I want you to blow out all the air and count loud to 50 and watch what happens to your voice. Don't take another breath. Count loud to 50.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16.
Where do you feel it? Do you feel it in the lower throat?
Yeah.
Tension?
Well, I can't breathe too, so it's forcing me
but
to.
it's very tensing.
Right.
That's what spasmodic dysphonia is. People with spasmodic dysphonia, believe it or not, talk without air.
Oh.
They talk without air. They reverse the breathing, like you did. They reverse the breathing. You have a chance, if you continue to talk the way you're talking, with reverse breathing and in the lower throat, in my mind, a chance to get the strangled voice called spasmodic dysphonia, which the medical community says is hopeless, and they Botox you 4 to 10 times a year or more each and every year for life, and report there are no cures of your condition. They don't look to the natural cause of what your problem is, whether it's a nodule or what I'm talking about, the strangled voice. I'll do it for you.
Well, I had this problem, doctor, when I first noticed it. The voice began to break, and then I couldn't talk.
Now that's an unspeakable voice. That's a hopeless voice. And these patients are told that they're hopeless. And I report cures of their hopeless voice problems. The interesting aspect is what you have can move from a nodule, which is simply a growth on the vocal cords, like a callus on the back of your foot. When you wear a wrong shoe, you get a callus. Would you continue to wear the wrong shoe?
No.
Why not?
Because it hurts.
Yes, but it hurts. But how do you know to change it?
Because it's uncomfortable.
How do you know to change it? Because you can feel it and see it.
Exactly. That's too
So you're
small.
not relying on an ear, nose, and throat doctor or a medical doctor to tell you
Right.
to change the size of the shoe. You're using common sense, right?
Right.
Okay, now I want you to say mm-hmm.
Mm-hmm.
Where does your mm-hmm go?
CD.
Right. That's where I want your voice to take it out of the lower throat. And I want you to hum, just hum, and put your hand on your midsection. Just hum, like hmm. And tell me what happens with your midsection.
It's going in.
Goes in. It's not going out. So when you hum, you're doing what is natural. Right? Then why, when you talk, does your stomach reverse?
I don't know.
Because you picked up the wrong pattern.
Wrong habits.
Yeah. Did your mother ever tell you to hold your stomach in?
No, she never. I was told that.
You were
through-
told that. So
Yes.
that's what you did. It's all wrong. That's the culture. Women are told to hold their stomach in, and the men, for macho, think it's very, very meaningful. Maybe because they want to hold the gut in. But the problem is, when you do that, you tense the body, and you make nature doing what it can't do. When you sleep, your stomach goes in and out naturally.
Right.
You're reversing it when you talk during the daytime.
Yes.
And in the morning when you wake up, your voice is low.
Very low.
Do you clear your throat a great deal?
Uh-huh.
That's due to the fact that there's a mucus gland between the true and false vocal cords in your neck, in the larynx. And when you talk in the lower throat, nature tells you you're doing it wrong by giving you a shot of mucus. You keep doing that. If you use your voice correctly, your voice will go on and on and on and on. There's a very humorous story. I worked with a psychiatrist's voice some years ago. I was a presenter at a psychiatric meeting, and he came up to me after I was talking about voice and how people commit voice suicide. And he told me his wife can only talk 5 minutes a day. Could I consider seeing her and help her? I said, yes. It sounds typical and normal. So I saw her. And then he called me back about a year later, and he was very depressed. When I first met him, he was very outgoing, and he had heard me, and he was taken with the fact that I might be able to help his wife. And a year later, he called me, and he was very, do you remember me? I said, sure, I remember you. He says, you know, my wife doesn't stop. She can talk 25 hours a day. He says, is there any way to change it? I said, no. You asked me if I could help her.
You're like, and I did.
He didn't finish this conversation, just hung up on me.
Oh, no.
So sometimes when people want something, it's not what they're going to look forward to. The interesting aspect is our voice. If we use it correctly, it will go on and on and on. Hum the first bar of Happy Birthday. It's not easy to talk there, is it? Let me see you say happy birthday at that.
Happy birthday to you.
I want you to go higher. Happy birthday to you, Mort Cooper.
Happy birthday to you, Morton Cooper.
Right, you got part of it. Say it again.
Happy birthday to you, Morton Cooper.
How does it sound in your head? Come on, this is honest
In
time.
my head, it sounds a little like
Minnie Mouse?
Yeah, Minnie Mousey.
Robotic? Superficial? Artificial? Not you?
Like I'm forcing it.
Yeah. Well, remember, you have lost the auditory memory of what your old voice, your natural voice was 6 months ago. You never had trouble with your voice before then, before you lowered it.
And I used to cheer in high school, and
You're right up in your face and you had volume. Okay. Nadia, it's been a pleasure talking with you.
You also.
Folks, if you have a bad voice, a raspy voice, if you have what is called a hopeless voice, don't live with it. Realize that there is a chance, a real opportunity by you using your natural voice. My books are in the library. You can read about what I'm doing and understand that you can try to self-help and do it for yourself. I'm Mort Cooper. The title of the program is called Change Your Voice, Change Your Life. And it literally means that, not figuratively, because when you're talking like this and you don't have a voice and you have a nodule that hurts to talk, your whole life has changed, your career has changed, and your personality has changed. Is that true?
True.
Thank you very much.
Thank you.
I'm Mort Cooper. Bye-bye.